All right, on today's show, I welcome on a very special guest. He is Dr. Tim Swenson. He's the owner of Primal Physical Therapy and Sports Medicine. Doc, how you doing today?
I'm doing great, Jeff. How are you? Thank you so much for having me on. I'm excited to sit down and chat hoops with you and see where this conversation takes us.
Yeah, definitely. I'm very excited to have you on the show. I mean, I know we talked a little bit off air of what you're doing with Primal, and it sounds very exciting and so awesome, like what you're doing and everything like that. But before we get into what you're doing right now with Primal Physical Therapy, I want to know, how did you fall in love with the game of basketball?
So I have to attribute that to my parents. They were both athletes growing up. And from the time that I can remember like being able to walk, I feel like they just surrounded me with so many opportunities to like fall in love with sports. And they love basketball so much. And it just kind of came naturally to me when I was growing up. I always had that little Tykes basketball hoop, with the plastic rim that was adjustable.
Yeah.
I must have broke that thing like 8 times. I swear to God, it was something that I would use frequently. And so ever since I could start dribbling a ball and shooting a ball, my dad was he was my coach from such a young age. And then up until the time I went to high school, that was when he last coached me, formally. And I was always playing against competition that was older than me. It has advantages of being a little man child when you're like 4 years old and you can play against guys that are 6 years old
Yeah.
and kind of get, a good, experience in at a young age when you're playing with older kids. Because my cousin was a few years older than myself. My dad coached him first, but I would always go to the practice. I always wanted to like be with my dad and hang out with him. And I would want to just show up to the practice no matter what. So I would go, I'd hang out, shoot around, dribble, and my dad was like, "No, this kid's really good. Like he's just gonna play with us. I don't care how young he is." So I was very fortunate to have my parents like really, you know, allow me to be around and surrounded by basketball at such a young age. I played, other sports and stuff like that too. But basketball is the one that stuck with me, and I've been very fortunate to be able to play ever since then. So that's kind of where things got started, and then you know how it goes from there. You go from such a young age, and you just keep maturing and keep playing, and then eventually I started playing with kids that were actually my age, and then we developed a lot of chemistry together, and ended up playing high school with a bunch of those guys. So it's been a long time, man. It's a game that's been very good to me in so many different ways, and it's still coming back around. And I just want to keep myself around that environment just because I'm so passionate about it. I love it so much.
Yeah, that's amazing. I know I feel that grew up the same way. Basketball has been like my favorite sport growing up. Obviously, it was there also like when you were playing and starting to recognize that you could hang with the older guys and being like that. Was there like a time where you're like, all right, so this is a sport I want to do like all the time and just be a part of it constantly? Is that like a time that like you kind of noticed as you're just playing?
I think I was just so when I was growing up, I played a bunch of different sports.
Yeah.
Like I had no question about how much I love basketball, and we always had a basketball hoop in our backyard. And I'm talking like when it was freezing cold out, growing up in the snow belt in Massachusetts, we'd always have some snow on the ground in the wintertime. We'd always have to shovel the driveway out, but we'd have a light on, and my dad and I would always clear some space on the driveway. And even the weather was, not great, we'd still go out there and shoot hoops after dinner, and we'd still like, do some drills and mess around and stuff like that. So I have always had like a passion for basketball for sure, but I just wanted to try a bunch of different stuff. So I played baseball, soccer, football, and a bunch of different sports growing up. But over the test of time, basketball was the one that stuck with me the most. And you can probably attribute that to the fact that I'm 6'7" and kind of just naturally came into that sort of a role. And apparently, the rest of the world thinks that if you're 6'7", you should automatically play basketball. So that bias has stuck through for myself at least. And yeah, basketball has always been it for me.
That's awesome. And so when you being 6'7" and then being playing basketball and everything. So in high school, did they just automatically put you at the center position where you're like, I want to play like a shooting guard or something like that? Or do they always put you at center?
Yeah, well, when you have a point guard that, doesn't want to pass to the basketball and just wants to jack up shots, and there's only so much you can do. I don't know. I
Yeah.
at a certain point, I when I was growing up and I wasn't, taller than everybody else, we always had like a pretty large group of kids that I play with. But before I hit my growth spurt, I would handle the rock a little bit. I was very used to being able to like control the offense, bring the ball over half court, dribble the ball up, that kind of stuff at a pretty young age. So I always had a pretty good, handle for the ball, and I always had a really good like anticipation and instincts. And I feel like I've always been like really good job of being able to set my other teammates up for, easy buckets. And, I just had like really good vision on the court. But then when I grew, ultimately my position changed and every coach was just like, get under the hoop. And now today, obviously it's very different, right?
Yeah.
With how the game's evolved. And so I had one, I had one game when I think it was in JV. Um, my coach in high school, we were playing some trash team. They were so bad, but we were just out there like, basically finish the game up. And for some reason, he thought that I was just a corner three specialist for that game in particular. And I missed I missed maybe like a few shots in a row from the left corner. And I'm like, oh man, I'm getting frustrated. I'm getting like, do I even want to shoot this anymore? And they were leaving me wide open. And I'm kidding you not, this man just started screaming at me from the sidelines, shoot the ball. And I'm just like super nervous about it. I swear I must have went like 0 for 12 from 3. And it was a tough shooting night, man. So the whole like stretch 5 for me, that was not my mode of operation. I would seldom take threes. Sometimes I would make them, but I was always very hesitant to just jack shots. If you think about how Zion and Giannis play, like they just have such a height and a physical advantage. And that was the kind of competition that I played when I grew up and in high school. So I could just always get to the hoop and score, like no matter what, just because I could get to the paint,
Yeah.
get a bucket, no problem. And I would just rather do that than sit around and jack up threes that my coach is going to scream at me for taking.
I just
Yeah.
like how he was just telling you to shoot the three. Like you don't
He
see that.
wasn't telling me, he was imploring me. This man was like, I felt like if I didn't shoot that 3 that he told me to, I would have never played again. And ultimately he became my high school coach, and it became like a running joke over time. And like I don't think I ever took a corner 3 from the left side of the hoop ever again.
How were you on the right side?
Better because I'm a lefty, so I
Yeah.
have a different angle at the
Yeah.
hoop.
Yeah. Yeah.
Yeah. Yeah. So a little bit different. I'm
Yeah.
not out here breaking numbers like Steph Curry or anything like that, but I did have a pretty like okay jump shot in high school. I just didn't really get too many opportunities to work like around the wing or away from the basket. I was pretty much primarily just in the paint.
Yeah. Well, yeah. I mean, yeah, it makes sense. I feel like anytime anyone was over 6 foot here, especially around in our area, it's the same thing as like you're in either forward or center, and that's it. It's a completely different game now. Like you mentioned, like everyone I plays every position. It's like you're no longer a center. It's like positionless basketball now that we see it.
It's so impressive to see guys like you see what Brook Lopez is doing right now in the finals. I'm just thinking of him as an example. Because ultimately, when he started off in the league, it wasn't that way. And then Steph Curry came and totally broke the game for everybody.
Yeah.
And then you saw him evolve over time as a guy that was primarily just a pick and roll specialist and roll the hoop. And now he's been able to step out and fade and pop on those high pick and rolls and, shoot the 3 from, at a pretty reasonable clip for his position. He's changed so much and he's developed such a different game where he's a huge asset to the Bucks, who are, a game away from winning a championship.
Yeah.
But, I when I was playing even in college, that was never something that I really adapted to. I never really felt like a jump shot for our team from me was ever like the best shot. Like we were such a good offense, and we had so many different guys that could get open and get really good opportunities to score. I just felt like if we were to get down that side of the court, like we could get a better shot than me taking a shot.
Yeah.
From I wasn't going to do that. So that's just kind of how my mindset had always been. And yeah, and honestly, like I'd rather be down low, as weird as that sounds. I'm like one of those psychos that just like loves to try to push people around and like create contact and like, you know, I just love that kind of stuff. That's something that has changed for me, because initially when I was growing up and playing, I wasn't that way. I was really like shy about contact. I just didn't really have like a physical presence. I was just really tall and lanky.
Yeah.
And then things changed for me drastically when I had to actually eat some food and work out. Go figure, add 30, 40 pounds in college, and then things are a little bit different. But it's also a mindset thing too. I feel like I got, physically mature to the point where I just felt comfortable in knowing that, with how I was training and how I was practicing, I could just get in the post and hold my position well against anybody and, create an advantage for our team.
Yeah, I mean, it's great. It's you don't see that too much often either as well too, that the body, to push the guy, like push the guy around, reminds me of Tyler Hansbrough, like someone that would just like the body up with someone.
Psycho T, yeah.
Yeah, Psycho T. Yeah, that's what I was thinking of.
T.
Okay,
I'm
yeah.
a big UNC fan, so I love Tyler Hansbrough.
Yeah.
Yeah, he had a short-lived NBA career, but man, that kid had one hell of a college career, that's for sure.
Yeah, he could play. He was a threat, and he was the ball. I mean, I think always the mind, like when I think of Psycho T, it's always that. I think it was the UNC Duke game.
Dude,
He has
yeah,
nose was
the
bloody and
blood
like
nose, yeah.
just totally like whatever.
It's
Like,
iconic, man.
yeah, yeah.
Yeah,
That's what
absolutely.
sticks out to me the most. But like, uh, you mentioned you played in college, and I kind of want to take a little bit step back too. You said you had your first injury as well too when you're 12 years old with your knee and everything. Well, what had happened? What injury did you suffer?
So when I was growing pretty rapidly at a young age, I never really got strong enough to the point where um, my muscles and my joints were able to kind of take all the force that I was producing just with the amount of like playing time that I had either on the field or on the court. And it's actually really typical injury for adolescent males and females that they'll get, like, basically it's called, Osgood-Slaughters, or just some basically pain in front of the knee where that, quad tendon inserts, and it can get really inflamed and, eventually break down over time just because movement mechanics fall apart. The joint stability all the way through like the ankle and foot, knee, hip, everywhere up and down the chain are, unstable to a point where they just can't dissipate those forces. And a lot of times it just ends up happening where the knee starts to flare up and have most of those issues. So that was problem number one for me. That was where I first started to notice, hey, when I jump and run, like, this is not feeling good anymore. And as an 11-year-old boy, I didn't really know how to explain it or describe it so well to my parents. And I just kind of figured, and I think they figured, at least for a small amount of time, it didn't last that long, that it would eventually go away. Oh, just dial it back, put some ice on it, don't play as much, it'll go away.
Yeah.
Right. And
it's the mentality.
it persisted over time to the point where I tried to move a certain way so that my knee wouldn't feel that sort of pain when I ran or jumped or cut or any of those quick movements. And so I started developing some pain on the actual inner portion of my knee joint. And this was a different kind of pain. It was like a sharp stabbing pain on the inside of my knee whenever I would put weight on my leg. And it got so bad to the point where we had to go see a couple of specialists at like around the Boston area. Ultimately went to Boston Children's Hospital to get looked at. And I was 12 years old at this point. So I hadn't really hit a growth spurt, but I was a huge fan of Quarter Pounders and Mountain Dew. So I was, I had some weight on me. I was a little pudgy, but I just didn't really know how to move very well. And unfortunately, my knee just took so much, it just got really banged up over time. So they looked at an MRI, sat in the giant tube magnetic thing for like an hour. It was horrible. And I come out, and the doctor who looked at the MRI had said that there's bone on bone contact on my knee joint, right on the inside part of the knee, where your thigh meets your lower leg bone. And, as a 12-year-old child, like that's not something that's normal. That's not supposed to happen. That usually happens way later in life where there's no joint space left. So the cartilage had just completely worn down in that specific spot in my knee. And, cartilage at the end of your leg, or really in any of your long bones, doesn't grow back on its own. It's not something that you can just hope will get better with inflammation and rest and exercise and stuff. That's something that needs to be like physically repaired and surgically repaired. So I think I had mentioned to you before that I ended up having a microfracture surgery. So 12 years old, I had to go in for microfracture surgery for my right knee. And that is typically from everything that I've read and, learned in school, it's basically like a death sentence for people that are trying to play, sports long-term. Right. And I think I gave you the example of Greg Oden.
Yep. Yep.
And so Greg Oden had that same sort of a surgery when he was, I don't know the exact age when he had it, but he had a ton of knee issues. And ultimately he had to have a minutes cap and a games cap when he was in the league. And you know how the NBA goes, man. If you're not available to play, you're not going to be with the team for very long.
Yeah.
So he was ultimately phased out of the league, and it's unfortunate that happened. So I had my first injury, or surgery rather, when I was 12 years old, and then that basically put me, in crutches over the summer. Had to miss my 7th grade like basketball season. And then, I had to go through a ton of rehab and a ton of PT after the fact to just be able to walk the right way again, just to be able to try to like move without having as much pain again. So it's, pretty much starting from day one, just such a long and arduous process that, as a 12-year-old kid, you don't really know where or if there's like an end in sight. Like, am I ever going to be able to play basketball again? Am I ever going to be able to run again without having pain? So that's why I always felt like from that very moment that being able to use that first experience, and then, I had subsequent experiences with physiotherapy and other surgeries after that, to just be able to help relate to people that I work with.
Yeah.
Because I know for a fact that mentally it can be exhausting and psychologically debilitating to have to sit there and miss out on a season and sit there and watch your friends play, or sit there and watch them like, have struggle in a game and not be able to help them out, or, just any of the things that come with not being able to play and enjoy the things you do, and just being able to be social as, a kid growing up. And then I had the same exact surgery happen on my left knee going into my junior year of high school.
Oh my God.
So round number 2 is different, same spot, just on my left knee though. This was right after I actually did hit my growth spurt. So over a very short span of time from freshman year to sophomore year, I went from 6'1" to 6'7".
Wow.
So that's exactly what I needed in my life, was more awkwardness and more coordination. So, right on point with almost getting braces. It was just like everything, the stars were aligning for me. There's definitely no, I did not have many girlfriends in high school. It just didn't happen. So it is what it is. But
yeah.
So my second knee surgery, I was bumming because I was basically racing to get through rehab to be able to get my doctor to clear me for my junior season. And I could feel so like I rushed back in my junior year in high school. I hadn't been able to train in the off season. I was just coming off of a knee surgery. So all summer long, I just was immobilized and couldn't play. So for the first several weeks, my conditioning was horrible. I wasn't ready to play. Our team definitely suffered because of that. But I ended up finishing the year okay. Didn't get injured or anything like that. But there were numerous instances where when I didn't need a surgery, I would still have these random joint problems pop up where my knee would still hurt, but it'd be in a different spot. Or, my lower back would start to kind of bother me a little bit and tighten up. And, now knowing what I know and now have gone through the process, I can tell you straight up, I didn't know how to move, man. I was just so, I was just such a mess from being on crutches so many times, being immobilized so many times, having to deal with, you know, trying to change how I'm moving because I'm just in pain. And ultimately, that leads to so many different changes in your nervous system and how your brain is wired to jump, run, walk, all those things. So I never really learned how to do a lot of that stuff the right way. And then also like trained on top of that, from like a strength and conditioning perspective. So fortunately, I've been able to take a lot of things in stride and be able to, use all those negative experiences that, ultimately like I struggled a lot, man. It was a tough time frame for me to go through all that stuff multiple times, And so when I was picking out and figuring out what I wanted to do for a career, it was a no-brainer to me. I wanted to help people go through the same stuff that I went through. I wanted to be able to use my experiences to help other people, kind of guide them through what I had learned. And I always loved sports. I was always really good at school. I was always a good student. And so fortunately, my calling in life like came to me very easily. And I know that a lot of people can't necessarily say that. So I definitely do feel lucky about that,
Yeah.
even though it had to come through some struggle. But I think it just goes to show you that even though in times of struggle, there's always something that you can take from it. And there's always something that you can, use that to grow as a person, and you can use those experiences to help others. So I can't think of a better way to be able to do that than to be able to do what I'm doing right now.
Yeah, it's awesome that, I mean, it sucks that you went through all that stuff. I mean, unfortunately, but I guess there's a silver lining in the whole package of everything that has happened to you in your past, like in your past injuries and everything like that. Before we get into the primal physical therapy, I want to know too, like, what was it like for you mentally to kind of like, I know I've had some injuries playing basketball, and mentally, like it took me a while to like even want to drive to a basket again or even go up for like a certain thing. Like what mentally, like, you play it at the next level too. And how did you mentally overcome that? And you just said you like to be physical. So like, what's it like to kind of take that next mental step? I mean, what mentally helped you get there?
Yeah, that's a great question. I think when I came, so let's run it back a little bit because when I was going into my freshman year at Springfield, I was recruited to go there. I was in my head, I was going for physical therapy. I got accepted. I got some really good, scholarships and grants and stuff like that. I was all pumped about it. Talked with the coaches, stuffed my face at the dining hall. I was like down. I was ready to go,
Yeah.
playing basketball there. And ultimately, my freshman year came around and I had to really buckle down, and school was tough for me, man. It was a tough adjustment.
Yep.
So I uh I went through training, like preseason, all that stuff. And, I was getting not a bunch of, but a lot of my really important classes, I wasn't excelling in. It was something weird for me because I've never had to struggle in school like that, or I've never experienced a struggle in school like that. And it was purely because I had really poor study habits, and I had, no understanding of how I genuinely learn things. Because in high school, for me, to be honest, I just was I was able to get like good grades without having to put in too much effort.
Yeah.
But like going to school and doing all these classes was so different for me. So I wanted to be able to just focus and dedicate more time to other things, to just make sure that my grades were on point rather than, playing basketball. I just kind of shied away from that. But I had a couple of close friends that are on the team. And my sophomore year in college, I had to have my third knee surgery. So I had one of my close friends who was the point guard on the team at the time. Um, we would always go to the game and watch him and support him. So I was always like at the game and I knew how things were going. And, coming off my third knee surgery and rehab, I had to have a revision done on my first operation on my right knee. I was just in a really, really like tough place mentally. Um, because I had to crutch around campus everywhere and it was disgusting and it was just horrible. But two, just because I'm thinking to myself, like, am I ever gonna be able to like play basketball again? Am I literally ever gonna be able to play basketball with my kids when I'm older? Am I gonna have that sort of longevity, or am I just gonna keep getting injured over and over and over again? And it was sickening. I was in a really, it was just tough to wake up and just be like, oh, yep, on crutches again. Yep, have to go through my home program again and have to learn how to walk again and all that stuff. So this happened early on in sophomore year for me. So as their season kind of winded down, I was basically getting to the point where I could start to play basketball again. And I just kind of had a flip switch in my brain that I said to myself, I need to like, if I don't try, at least, if I don't at least try to make this work and try to play basketball again, I'm going to really miss out on an opportunity that I'm going to be pissed at if I don't take it.
Yeah.
So going into my junior year, I had just a mindset switch of, okay, if I need to, if I want to do this, I need to really work freaking hard. I can't just like sit back and do the stuff that I've been doing and be, mediocre effort level with like training or with, get on the court and do my thing. I need to work really hard to get back at it, especially coming off my third knee surgery. So that summer is when things changed for me a lot. Uh, like I said, eating food and lifting weights helps a lot. And being able to do that stuff in the right manner put me in a very different position for being able to, compete for a position and then ultimately like help our team, have a really successful year as a junior. So from then on, like literally from that summer on, I've been just making that a habit as far as having really good routine with working out and training, uh, eating, attempting to eat well. It's not a 24/7 thing. I
Yeah.
promise you, last weekend, the last 3 days, it hasn't been 24/7 thing, but it's definitely just more of just awareness
Yep.
about how to do things the right way and how to go about your business to just, put yourself in a good position to have success. And a lot of it's just effort and awareness and, being understanding that it's a process. Nothing really great happens in a day. It takes time for things to build up and it takes time for, amazing things to happen over time. And I've been able to keep that sort of mindset since that point. And fortunately, like I mentioned to you earlier, I'm almost 30 years old and I feel as good as I've ever felt when I'm playing basketball and even after the fact. And I don't have a cold tub anymore like I did at school. We were spoiled. Like I love that thing. But I wish I still had one. Don't get me wrong. But I do still feel great on the court and even after the fact too. So I'm just I would just have to attribute it to the effort, the awareness, and the whole mindset shift. You know, just kind of like digging yourself out of it. And it is such a mental struggle with so many things in life
Yeah.
that you kind of feel like you're getting weighed down with. And, a lot of self talks and reflection over time just helped out put me in a better position, you know?
Yeah, that's great. I completely understand that. And I mean, it's awesome that you're able to, create that mindset and still live by that mindset even now today with everything. And like you said, eating is not 24-hour, like eating healthy is not always a 24-hour thing. I know I feel I do the same thing as well.
Yeah.
This past weekend was not good, but, but how did you bring that mindset now to, how did like with you to your profession with as well?
Yeah. So right from the very beginning of when I started working as a outpatient physical therapist right out of graduate school, I've always tried to put myself ahead by just putting in a whole lot of effort and just trying to learn as much as possible and trying to help the people around me as much as possible and just be a really good teammate. And I think that so many of those qualities came from sports and athletics, as far as being able to overcome challenges and realizing that you got to put the effort in if you want to get the right results. And if you're not getting the right results, you need to look at yourself and figure out where things need to change.
Yeah.
So just as a teammate that's always like looking out for people around him, that helped me get to a place where I was in a really good environment at the spot that I was working in, had a great team around me, a lot of really fun and smart and energetic people to be able to learn from and build confidence and build professional and clinical skills. And I was able to do that for 4 years. And without a shred of a doubt in my mind, I've always known that working as a physical therapist and helping other people overcome obstacles and injuries and challenges, that's always been something that I know I'm passionate about, and I really like am very lucky to be able to do that every single day in my life. And it's a lot about just being able to stay steady with it and be consistent with your efforts. And over time, so many different things can come your way, opportunities that happen, or things that you put intention on happen, but sometimes stuff happens out of the blue, and it puts you in a really great position too. So I just feel very blessed to be able to do what I'm doing.
That's awesome. That's great. Yeah. And how did this everything lead to you to start Primal Physical Therapy and Sports Medicine?
So I had worked for an outpatient company down here in Rhode Island for about 4 years, and I learned so many things about just in general about being a physical therapist, but how to also do it at a really high level and to get people really good results and to help them, achieve their goals, and also have them tell other people about it too. So just help kind of like build that sort of network just by doing a really good job and looking out for other people. Um, I've always kind of known or wanted to at least someday put it out there to like own my own business and start my own thing, but it's not something that happens overnight. It definitely took a lot of time and planning, and ultimately a huge leap of faith to be able to leave a really great job position and to start up something completely on my own without having you know really any sort of like business managerial experience. I've never owned or operated a business before. I never went to business school. Like, so for me, it was something that was just more about confidence in myself to be able to do a really good job at the service that I'm providing and to just help other people. And the opportunity and situation arose where I was able to find space at a sports training facility right in Warwick. So when I was doing some research on just the territory in general to see like where I could set up shop, it worked out really well that the place that I work out of now, it's called Northeast Sports Training, and it's right next to the airport in Warwick. They have a really little small office space that I can occupy in there and work with patients in there. But also it's just a phenomenal training facility to the point where I can, you know, take my patients and my clients out into the gym and have that freedom of space that, you can't really get at another physiotherapy office. There's just no other outpatient physiotherapy office that's really, allowed that kind of access. And fortunately for me, I work with a lot of people that are, of an athletic background or have an athletic mindset and want to be able to use that space, that equipment, and then take all the stuff that we're doing and be able to improve just their, performance level or hit their goals that they're trying to achieve, um, to a different level in a different capacity than they may be able to do at a different spot.
Yeah.
So
I think it's an awesome idea. I know we talked about it off air a little bit. And I think, honestly, I think it's great. And it sounds like a great location and everything like that. And what's the idea behind, like, I know what you're trying to do, but like, can you explain more of like, you're trying to get people athletic, working with the athleticism and stuff like that, just kind of do other training as well too? Is that what we're trying to do as well?
yeah.
Yeah.
So I guess there's a multifaceted approach to my business plan and the model that I'm rolling with right now. If you're coming in and you're injured and you want to get a script from your doctor, or you have a referral from your doctor, or if you have health insurance, you can come in. We can go bill through health insurance. As much as I hate that, but that is one option for sure. But conversely, if people come to me and seek out my help, obviously I've been marketing and trying to direct efforts towards basketball related, population. I don't want to limit it to just basketball, but pretty much any sport in general. But basketball is like my forte for sure. But basically what I do, if somebody comes to me and they say, Tim, like, I got this going on, I want to get better at basketball. Like I want to make the varsity team next year, or I'm going to go play in college. Like I got to get better. Can you help me out? Basically what happens is I have that person come through on day one, and I have an evaluation and a biomechanical screening tool that I use that I developed from a lot of different courses that I've taken over time, and just from general knowledge of, human anatomy and biomechanics. And I have all of that templated out. We go through that whole evaluation. It takes about half an hour. And then once that evaluation is over with, I look at, that player, that athlete, and say, listen, I'm seeing all of these things. You're coming to me because your knee is hurting you, or you have lower back pain, or you sprained your ankle a bunch of times, right? Like we're taking a history to see, how often do ankle sprains happen in basketball all the time. It's the most common injury in basketball. So all of their prior injury history is basically, recorded. We talk about that. We make sure that we're on the same page with their goals, what they want to achieve. But a lot of times there's so many underlying things in people that are perfectly healthy too. They don't have to be in pain. They don't have to be injured. If anybody is just healthy and they still want to get better at basketball, then I'm here for that. It's just, we got to break things down and look at it at a microscopic level from a joint by joint perspective, and be able to figure out, okay, well, does your back bother you when you're playing because you lack, some stability when you land on one foot? Do you lack, posterior chain, like glute, hamstring, like activation when you're trying to jump or sprint? Do you have really bad posture and your core muscles are very weak and they just kind of crap out over time and you just get tired as the game goes on? Whatever they may be, we come up with and we figure out exactly why that kind of stuff is happening. We document it, we record it, and then we come up with a game plan on day one to say, all right, listen, this is everything that I'm seeing here. Once we can clear up all these issues, let's say we can get your hips to rotate better, I can get your ankle to actually bend the right way. Once we start to clear up these mobility and flexibility and movement deficits and limitations, that's when we can start introducing certain movement patterns and certain exercises that are going to help improve, their strength, their coordination, their endurance, their ability to jump on the court, their ability to, slide over and take a defensive slide. Maybe it's their ability to just run from end to end without any sort of issues. So it's about kind of clearing out the underlying issues to why they're not moving well, and then being able to apply a science-based approach to help them move optimally. That's going to eventually translate to, improved success on the court, performance improvements, decrease the injury risk, just identifying all those factors that may eventually lead them to an injury. So it's a pretty comprehensive plan of care that you can't just get like through your insurance plan, or, just going to some Joe Schmo that like has no idea what they're doing. So being able to work with athletes and track their progress over time has really helped them to feel more confident on the court and to be able to feel that difference on day one. Most people typically do feel a huge difference on day one or the first game or practice that they go to after the fact. I've had a bunch of guys, text me or hit me up like literally after their practice, their game. And I had one actually over the last weekend. He hasn't been able to dunk in, he had a quad tendon tear, hasn't been able to dunk in since his injury, was worried he would never, ever be able to dunk again. And literally the first game after I saw him day one, he told me he threw down a monster dunk and out of nowhere. I had like, you just couldn't believe it.
Wow.
So, for me, that's like,
Yeah.
that makes me so happy, man. Like just being able to give somebody the confidence again to be able to go back out there on the court and know that they can dominate and know that they can play without having to worry about being injured or getting, hurt again. Not to say that those injuries can't happen, because those are always something that you can't fully prevent, but you can do as much as you can to try to reduce that risk. That's what gets it for me, man. I just love being able to use the game of basketball to create relationships and to be able to use the knowledge that I have with the movement, excuse me, the movement system for the human body. It just kind of comes together, and that's ultimately what I want to keep doing to help, excuse me, grow the game of basketball.
Yeah, I love it. I honestly, I know we talked about it off air, and then the more you talk about it now, still, it's it's so, I think it's such a great idea, and I think it's something that we kind of lack in Rhode Island, that we don't have that science behind of like, a quick how to recover from this, and how to, the movements and the processes of like how to get back to where you were before, and how to maybe do preventative things to prevent that injury going forward. Like you said, you can't prevent them all the time, but there's some kind of science behind it. And I love that you're bringing that here to Rhode Island, to these players, to these young men and women, to have something to have going forward that they can look forward to. If they have some, like you mentioned, the young man who had a quad injury that now can dunk, could get, like, didn't have that confidence, and help him work back that area. It's awesome. I think it's awesome what you're doing. I think it's such a rare thing that we don't have. And I think that just like makes me happy, because it's just like one thing that Rhode Island basketball players need. And we're taking the next step for our players in our state to get them to a whole nother level as well too.
Yeah, man, I appreciate you saying that so much. I really do. It's I was very fortunate to be able to actually network and kind of fall into a group of guys that I just met through circumstance. And they're all older than me and they can't move very well. So when COVID like hit and took over, we had been playing pickup on a regular basis for almost 2 full years on a weekly basis. It was a great run. And before we started getting back to playing for real over the summer, we were organizing some like group workouts, basically outdoors, spread out on a court. You're working with just your body weight. And for 40 minutes, I got these guys prepped up to be able to eventually play basketball over the summer. And so like that for me was great, because one, I hadn't seen a lot of them in such a long time. And then two, it's just great to see them struggle with like the easiest exercises on the planet.
Yeah.
And they were like, oh my gosh, this is so hard. And, they're sweating bullets and it's 3 minutes into the warm up and, they're dying.
Yeah.
But seriously, that's how it goes. And, obviously I had just mentioned you about like high school and college age, athletes and stuff like that too. But honestly, there's so many people out there that try to be those weekend warriors and play hoops in the weekends or playing rec leagues. And, basketball is a game for everybody if you can shoot and move around. It's not something that has to stop with a certain age necessarily. So a lot of guys that, I think would ultimately, and women too, don't get me wrong, but would ultimately benefit from, coming in to at least get a free evaluation. It doesn't cost anything. I do a free eval for whoever wants it, to at least come in and see where they may be lacking. And, I can guarantee you if you're, over the age of 30 and you sit at a desk all day, you probably got some sort of issue going on that's not going to help you move very well.
Yeah.
So when you get off your butt and get on the court, you're just putting yourself at more of a risk for getting an injury. So, it's just a nice thing that the state of Rhode Island is so small, and the people I've been able to share certain experiences with have sent, their loved ones, their coworkers, their friends and family to see me. And the word of mouth has been really, really, overwhelming. It's just such a small knit community and everybody knows everybody. So, I'm happy to be here in Rhode Island and be able to help people out because, there's so many schools and kids in the area that are looking to get better at hoops, and it's so competitive nowadays if you want to play at the next level that you have to be doing something different than everybody else.
Yeah.
If you're just playing basketball consistently and you're not working on developing your athleticism and you're not working on helping your body feel better, you're just not going to, plain and simple, you're going to have a less chance of getting to that next level.
Yeah, it's very, very true. I think it's just more than to just basketball. I think that it's either strength and conditioning or other areas, the aspect that you need to focus on to help build your athleticism or help you get to where you need to be. And I think that's just what you're doing is, like I said, such a rarity. And there's not a lot of people that do it. And it sounds like you have a great location. I think I might have to come in for a free eval because I'm one of those people that are
Dude, please do. I
Yeah.
would love to meet you in person and give you that eval and touch base. That'd be awesome.
Yeah, I'll definitely come in.
Yeah, hit me up. We'll figure something out.
Yeah, we'll plan it. Yeah, because I'm one of those people that are over 30 and sit behind a desk all day. So
Listen, I don't mean to objectify you. I had no idea how old you were, but I'm happy you fit right in that target market.
Yeah, right in that target market. So
that's right, man.
I'd be happy to be a test subject. Right, show everyone what's up. But that's no, this has been great, Tim. I really appreciate your time. Is there anything else that you'd like to speak on, question, comments, or anything that I did not bring up?
No, I guess just one thing, if I could just make a quick plug, thank you again so much for having me on the podcast. It's great to sit down, and I'm looking forward to hopefully getting you in person and seeing how stuck your hips are.
Bad. They're bad.
Yeah. Well, we'll see when that day comes, but I'll definitely be able to help you out. But, I just wanted, for anybody that's listening here, I do have an Instagram account that I'm trying to build up and trying to post in some content about, different things that we're doing in the office and in the training facility. So my Instagram tag is at Dr_Tim_DPT. You can just search my name too, Tim Swenson. It should show up. Please give me a follow. I'm going to try to keep posting some more content regularly with a lot of the guys that I'm working with for basketball training specifically. And, if anybody that is looking for some help, any young hoopers out there that are trying to take their game to the next level, that'd be awesome. I would love to help out. I'm here for all that stuff. So please feel free to reach out with an email, phone call. My website is primalptri.com. And you can reach me there through email and just check the website out in general.
Yeah. Thank you so much, Tim, for being on. We'll also share all that information as well, too, with the episode as well. So I can't thank you enough for being on the show. I'm definitely excited to come in for the free eval and possibly could have me as one of your patients come forward.
That's right, man. That sounds great, dude. I'm looking forward to it.
Awesome. Well, thank you so much for being on the show and best of luck with everything. And if there's anything that we can do on our end to help out as well, too, let me know.
You better believe it, man. I definitely will. Thank you so much again.
Yeah, no problem.